So, Josh Emmett,
All right.
thank you very much for agreeing to participate. I think this is going to be very interesting, and I hope that you're going to have, well, I know that you're going to have a lot of good stuff to share. So, thank you very much for that.
Of course, man. Thanks for having me on.
Not a problem at all. Now listen, brother. First of all, anybody who's showing up here, they know who you are. But just in case there are a few people who don't know who Josh Emmett is, please take a minute to tell them who you are and what you do.
Yeah, so my name's Josh Emmett. I'm a professional mixed martial artist fighting in the UFC. I currently rank 7th right now in the world, on my way to that #1 spot. And yeah, that's what I do. I've been in this game for a long time. I love what I do. And for people that don't know me, they can always go to joshemmett.com and, check out everything that I support and like a bio and everything like that. Is full in-depth things of myself.
Perfect. Well, so let's get right into it. I'm just going to give everybody a brief background as to why I wanted to have you on here, and then we're going to get right into the questions. All right. So Josh recently fought at UFC Apex 3, and Josh suffered an injury, and I did a video on that because, as you know, I'm an orthopedic surgeon. So I thought it would be nice to tweet that out to you, or show that to Josh, and he actually appreciated it. He actually gave me a thumbs up. So I thought, oh, you know what? Let's go one step better. It would be great to talk to this man and find out about his personal experience. So that's what we're going to do today. So having said that, the first question, Josh, please explain to us how you were injured at UFC.
Yeah, so this happened. It was like 19 seconds into the first round. I did it to myself, so I kind of blitzed in with a combination, and at the same time, I was coming in, Shane Burgos kind of stiff-armed me and pushed me back as I was coming in, and I actually, I hyperextended my knee, and that's what caused the damage. And I was asking therapists and other things like that if me continuing to fight caused that more damage, and they said no, it was just that one movement caused everything. So I suffered, I had partial tears in my MCL, I had a complete ACL tear, I had impact fractures, right, of the femur and tibia, and it also took out a huge dent out of the cartilage that sits in between the two bones. So it was definitely a painful thing. And I started playing like these mind games with myself. I'm having discussions because I really do feel like most people in that position, most fighters would have given up right then or looked for a way out. And that would have been okay given, a few days later, the injuries come out. So people would have been like, oh, it would have been okay. But myself personally, I would not have been okay with giving up. And that's something that I will never do. You literally, they'll have to knock me out or catch me in something in order to finish me. But yeah, so it was a challenging, a super difficult fight because I had to resort to plan B. And I didn't really have a plan B 20 seconds into the fight. So I just kind of, bit down on my mouthpiece and was just throwing hard shots trying to finish the fight. I just couldn't move. I really couldn't move that much because I had no stability, and just every single time I would plant to throw like a straight cross or overhand right, my knee would buckle. He'd kick me on the inside of my leg, and it looked a lot worse. It looked like he was doing the damage. And Shane Burgos is a tough fighter, great fighter, but my knee just kept buckling. I couldn't, put weight on that left side and go to the liver or throw hooks or just move the way I typically do in fights. But, it worked out. So I can't complain.
So my next question, you kind of addressed this a bit, but at the time, did you know, okay, my knee is toast? Were you thinking that?
Oh yeah, 100%. Because I've been an athlete my entire life. I've wrestled since I was a young child. I've wrestled all the way, in junior college at the 4-year level, and I've I tore my MCL once. I've done my meniscus. I've sprained ACLs before, but this was something completely different. As far as the knee, I've had a lot of injuries, and unfortunately, and just like the profession I do and the sports I've played, so I've had a lot of injuries and surgeries, and this was something different. Like mentally, I wanted to do a lot of things, but I would try to do it, and like I said, it would just give out. My knee would completely give out or buckle. There was nothing like stabilizing my knee. It was the oddest thing. So I knew, just because it was on the outside of my knee, like I didn't know exactly, but I just assumed that's ACL. MCL is on the inside. So I was like, it's something with my ACL. I blew it. And I said it in the first round to my coaches when I went back to the corner. And since we're fighting in a just a silent, empty, dark hangar, I went back to my coach Danny, and I was just like, man, my knee's screwed up. And he was like whispering. He's like, shh, shh, shh. He's like, we know, because they're trying not to let the corner hear. And it was obvious, like as soon as I did it, I reached down, and then it kept buckling, and I was just in excruciating pain. But at the end of the day, like I was saying, I'm like, I'm not giving up. I'm not going home with one check. I would just be pissed in a bad position if that happened to my knee. I lost, and all these things. There's multiple factors that would have played into this, and I would have been pissed. But I'm okay right now because I got the win.
Good. You know what? I've a few people on the stream here have said like that was like one of the most amazing fights ever, and like your will was like just incredible. And when I was watching it, it's hard for me as an orthopedic surgeon to watch these fights just as a spectator, right? I'm always watching as an orthopedic surgeon. And the moment that it happened, I was like, I was sitting there with my wife, ACL. I said, ACL.
Oh, really?
Right? And then I was like, this dude is just still like, that was a battle. And I just like, I was utterly amazed that you continue to go through it, because typically an ACL will swell up right away. Okay, if you tear a meniscus, the swelling is more of a delayed fashion, but ACL will usually swell right away, and it's quite sore, quite painful. And I was just amazed, like you were still going strong. And so, I have to tip my hat off to you, because I have to say, like that, that shows some strong willpower for sure.
Well, thank you. And that's one of the things that I always feel that, my mentality is something different than a lot of these fighters. Like I've had so many injuries, and even my debut in the UFC, I don't know if you saw that, but I had a compound fracture in my ring finger, and I was hiding that from the ref because I knew they would stop the fight. And that was my dream, to get in the UFC, and there was nothing getting in my way, especially even a finger. And I had to keep checking every time I'd block a kick. I'd see sweat in like my peripheral. And so I kept looking, because I literally thought he'd kick my finger off, and I'd feel the finger just flop back, and it was gnarly. And I've had like broken ribs in fights, and then just a lot of things. But that's one thing I welcome it. Like, I know it's a fight, it's going to hurt. It's the unknowing. But like I've said before, I'll go through anything to get my hand raised, and I'm not lying, and I will never quit. Like, they have to put me away.
That's like truly, that is like tenacity at its definition right there. Now, let me ask you something. And again, you talked on this a little bit, but tell us, so obviously the ACL is the primary stabilizer of the knee, which stops the thigh from falling off the back of the shin bone. So anytime you have to cut, pivot, the ACL needs to be doing its job. And you were able to continue for the remainder, for the next 14 minutes of fight without an ACL. So tell us specifically what you were thinking in your mind about how you had to change your game plan, whatever you had planned, to deal with that.
Yeah, and that's what it was. I had to make adjustments on the fly, just because I kept trying to do some of the things I wanted to do, but I couldn't. It would just, my knee would buckle. It was painful. Then I think kind of just towards the end of the first round, I just made a choice right there. I was like, what do you want to do? I was like, let's get the win. We'll be happy at the end of this because I looked at the clock. It was like 14 and a half minutes left, and I made that choice right there, and just continue to fight. So I didn't get to use the movement I typically do. I didn't get to go to the body lock. I didn't really get to incorporate takedowns and changing levels, because I basically couldn't. And you know, what I did do make adjustments into the third round is when I was hitting Shane hard, but I was not hitting him as hard as I could. And I personally know that because I could not plant on that front leg because my knee would buckle. And so that's why when I changed southpaw and I was dropping him with straight lefts, I was dropping him with overhand lefts. And that's in the third round. I know I hit a hell of a lot harder with my right hand. And because I was able to plant on that right leg, you know, and so that's why I go back to saying, you know, nothing against Shane, but I was like, if I'm healthy, I really don't think he gets out of the first round. And some of those shots I landed in the first round that, you know, they were hard, but they were nowhere near as hard as I hit. Like, I think those would have dropped him. Those would have put him out. Even when I got on top of him in his guard in the third round, and he stood up. At one point, he gave me his back, but I could not stand up and explode off of my leg to take his back. Or when he stood right up, I would have tried to kick him with my right leg, but I could not plant with that left leg. So I wasn't doing a lot of right kicks. I could still kick him with the injured leg because that didn't hurt me, and I could still pivot on my good leg. And people were like, well, you're still throwing your hurt leg. But I was like, yeah, I could throw the kicks, but I couldn't kick with my opposite one because then I'd have to put weight on that injured leg and pivot. And that was something that was just, yeah, it was just something different. I don't know how to describe the thing.
No, I listen, man. I've had my own knee injuries. I've had my own surgeries, and I know how much it hurts. So I think that's amazing. And I was gonna say, like, you know, if you had to estimate what percentage of your power you had, like, obviously, power from punches, unless you're throwing a straight, unless you're throwing a jab, power from punches comes from rotation. And if you can't pivot, you can't rotate, right? So what, like, if you were to estimate what, you know, you said it was less powerful, 80%, 90%, where do you think you were at?
Yeah, probably. Like, I don't know, maybe like 60-70%. You know, I was hitting him hard, but I really couldn't sit on that leg, like really sit on my punch and dig those knuckles into his body or into his face, you know, and that's where I'm saying, like, I'm throwing hard with my left in the third and I'm dropping him several times. And that's when I made the adjustment. And I just know I hit way harder with my right hand. So, but it's different. Yeah, maybe 70%. I'm not even sure, but I feel like the capability of me actually fighting, I keep saying I made it competitive because I was injured, and maybe I fought it like 30-40% because I really just stood there and threw big punches and just kind of stayed in the pocket and just moved a little bit, but I really couldn't do anything. I fought a, you know, top 10 guy in the world on one leg and still did well. So I'm just saying to all the other featherweights, they have no idea what I'm capable of. And when I come back, you know, I'll show them.
It's on.
It's on.
One of the things that always amazes me when I watch you is given your experience with wrestling, like, you're punching and dude, like, you're throwing bags of hammers every time you're throwing punches. And I'm like, why are you doing that when you have such a high wrestling acumen, you know? It's just, I'm amazed that you go to that, because it's like you have such a wide skill set.
And that's one of the things that, you know, I know we're in the entertainment business. I know what the fans want to see. I do feel like I could go out there, use my wrestling, take people down, grind them out, get wins, get decisions. It would be boring. It's not entertaining. I do aim to please. I want to be exciting and entertaining for the fans. And I believe if I were to go out there from the get-go and just kind of wrestle people and use more wrestling, like, I don't think I would be where I'm at as fast as I got there in my career. I know what Dana wants to see, the UFC wants to see big knockouts. They want to see, you know, kickboxing with 4-ounce gloves, but it's mixed martial arts. So I can implement a lot more things. I want to do that in this fight. I'm still never going to be in a boring fight. You know, I've never been in a boring fight. I never will, even if I do use a lot of wrestling, but I also love to box. You know, I was so close to getting in the UFC so many times. I was so close to getting on the Ultimate Fighter a few times. And, I only wanted to fight in the UFC. It was UFC or nothing for me. I got offered to fight in other organizations, but, the UFC is the biggest, best platform in the world. And that was my goal from the start. So I was almost going to transition with my boxing coach. We're like, man, let's start boxing because I loved boxing. And then at that time, then I got the call shortly after. So it worked out, the way it should and the way I wanted it to. So, I believe everything happens for a reason.
All right. So let's transition a little bit to now. Okay. So now you got your hand raised, boom, and it's like, oh snap, my knee is messed up. Okay. So tell us, you actually had surgery pretty quickly. So tell us how you managed with your knee between the end of the fight to the time that you had surgery. What kind of stuff did you do to take care of yourself, deal with the pain, and all that?
Yeah. So since the fight was on Saturday, I talked to the sports doctor for the UFC, and they're like, okay, we'll get the X-ray, we'll do the MRI on Monday. So, I'm just basically just walking around. I had a bunch of friends that still came to Vegas and my coaches and things like that. So we all went out and ate. I'm just walking around, no crutches or anything. I think they gave me not even an ace band, it's like some compression thing that a sleeve. So I'm walking around, and we're going to like some bars and stuff. And by the time I shouldn't be walking on my feet, then my knees like so blown up while I'm sitting there, and I'm in a lot of pain just because it's so stiff because of all the inflammation and all the blood to that area. So I go back to the hotel and I wait till Monday to get the MRI. And that's basically it. It came back. It was really quick, within an hour, and it was horrible. The results. It was actually worse than I expected. I thought it was just going to be ACL, but then it had a few of those other injuries. But you said that's pretty common when that happens, which I didn't know. And then I stayed in Vegas. I was working at the UFC Performance Institute. I was working with Heather and Bobby, and they're great, and physical therapists and stuff like that. And they wanted me to do the prehab. So I was just, I was working my ass off. I was doing 2 PT sessions a day. And they were doing everything from, we would do the acoustic sound wave. I was doing dry needling, cupping, obviously like the game ready icing, a lot of things to strengthen my quads and hamstrings. And, I was doing that from the get-go. So I did that for about 2.5 weeks, maybe 2 weeks. And I was kind of on the fence about getting surgery then, just because I felt good. Like I was doing things. I just don't want to be sidelined. That's the thing. I was like, I don't want to be sidelined this long. I feel like that's like that's like my career in a nutshell. I have a bunch of momentum. I win big fights, and then something happens and I'm out for a year. So I wanted to keep riding that wave. And, I had certain things where I was walking or doing certain lunges and my knee would kind of buckle a little. And that's just what Heather was telling me. She's like, if you don't do the surgery, and there are several fighters, there's a few guys that are at the top that don't have ACLs, I'm not going to mention their name, but it's like, so I'm just thinking, I'm like, I can get used to this. And then she said, but that's something I'm going to have to get used to, because it will not have the stability. And I just talked and thought about it for a long time. And I feel like I have a good 4 or 5 years left in my career, and I feel like I have a few years to make a run at this title, and I got into this later than most. So if I only had like a year or two, maybe I wouldn't go through with the surgery. If my career was almost up, or I only had 1 or 2 more fights left. But with that, how long I predict I have left in the sport, I just want to get as strong as possible, and I really do think I'm going to come back stronger than I was before. And so I decided to go do the surgery. That went really well. I used the patellar tendon, and they inject me with 2 different types of stem cells in there as well. And yeah, that's kind of it. After that, I decided to stay in Vegas for like almost 6 weeks, because Heather was telling me that the first 4 to 6 weeks are the most crucial when it comes to physical therapy. So they just started like hammering the physical therapy. They were aggressive with it. I was in there 2 times a day, every day. They would get me in there once on Saturday. And then after the first week, then I was doing strength and conditioning also. So I was at the PI for like 5 hours a day. I was doing other different types of testing. In between, I was doing all the icing and certain things. So that's what my, you know, my career is. I take this very, very serious. It's still a good investment into my career. And I did that for 6 weeks. So it was like Monday through Friday. Saturday was like half day, but every day it was like 7 to, you know, by the time I'd get home, and I was still using the CPM machine that was moving my knee. I was doing, you know, tons, just everything. That's all I did Monday through Friday for 5.5 weeks. You know, it was a full-time job with overtime. And you know, I got set up in Sacramento with a good physical therapist. And I got back here about 2 weeks ago and started the PT, and I'm doing that 5 days a week, and that's all I'm focused on right now. So today is 7.5 weeks post-op, and you know, everyone I've talked to, they say I'm so far ahead of where most people are right now. And so, you know, I'm going to keep on making the, you know, just big leaps and bounds, and hopefully continuing to progress. And yeah, and I'm just working on a lot of other things, even in my upper body, and different things that I've kind of neglected that I can really focus on now, because I can't do a whole lot.
Mm-hmm. Well, you know, you and I had kind of talked a little bit about the timeline that you had mentioned, right? And I was like, that's aggressive, man. That's aggressive. But if you're going to make that happen, right, doing what you've done, that's the way that it's going to be, right? Like if you're putting it, and your rehabilitation is your full-time job, then that's how it's going to happen, right? Because otherwise, you are just not going to be able to make up the strength, flexibility, proprioception, everything that you need to get back to the level that you want in that timeline.
Yeah,
so,
and so that, oh, go ahead. But I was just saying, I don't know, like certain things, like I know a lot, and maybe I'm wrong on this. I know it's like the 6-month marker can be, you know, there's a much greater risk of re-injuring it, like 60-70% each week. It goes down significantly until, you know, I don't know, the 11-12 month marker, maybe you're like 10-15%. Obviously, if it's like, you know, I like to gamble, so if it's 70-10, like I don't like those odds, you know, 70%, that's kind of scary. But obviously, you know, I'm not going to do anything that's gonna, you know, I just don't want to re-injure this. Like even now, like I'm at 7.5 weeks, and talking to you, talking to all the therapists are saying, you know, the 6 to 12 week marker is when it's at its like weakest point too. So even though I'm starting to feel better, I'm not going to do anything that my PT says I can't do. Like I'm not going to be like, oh, I'll go try to run, or I think I'll maybe spar tomorrow, you know. Like I won't do anything that's going to set me back. So I am still taking this very seriously, but I do want to have a fast return. I want to come back and, you know, be like the AP of MMA, you know, Adrian Peterson. He came back after 4 or 5 months after ACL reconstruction,
which is
ridiculous.
And
he's playing, you know what I mean? And he's playing in the NFL, one of the best. So it's like, I want to be the AP of MMA, you know, maybe come back 5 months, 6 months and fight. So we'll see.
All right. No worries, man. Well, I'll be rooting for you. I got my fingers crossed for you, man. So listen, you mentioned a little bit about the graphs that you had. So 2 questions about the graph. So obviously there are a number of different graphs: hamstring, patellar tendon, quadricep tendon. So the first question is, did you have a choice? And then number 2, why did you go with patellar tendon?
Yeah, I did have a choice. So it was the 3 that you mentioned, and the cadaver also. So you know, I just feel like I don't know. So it's like if I'm talking to a doctor, and I've had, you know, broken hands, and I've gone to other doctors that weren't sports doctors, and they were like older gentlemen. They're like, hey, how do you want to do this? I'm like, I don't know. I'm not the doctor. Like, what should I do for the sport I do? Like, I don't know these things. And I've had some bad surgeries and re-broke hands in the same place, which I shouldn't have. So I'm just asking, like, all like the best professionals that I work with, like, what is the best for my sport, for being an athlete? And I think, you know, a lot, like Heather, and I keep referring to her, but Heather Linden at the UFC PI, like she's amazing, and she worked at the Olympic Training Center for like 10-12 years, and then or maybe longer, and then she's been the head of the Performance Institute. She's worked with combat athletes for a long time. She has a lot of, you know, journals published and things like this. So I'm just saying what should I do, and talking to everybody, and they said, they just told me the patella is one of the stronger for athletes, it's better, but they also gave me some of the downside that if you're more of a grappler or wrestler, you could feel some pain in the, you know, your kneecap and patella. But she was confident that we're not going to experience that because they're so aggressive with certain things. And then just like the cadaver, I wouldn't want to have like a foreign like tissue in my body. I don't know where this comes from too, or the person it came from. And is that something that I've heard both, people have told me they know the person that it came from, and then people say they don't. Do they know like who?
So it depends on where you get it from.
Okay.
So some suppliers you won't know the name of the person,
Yeah,
but
yeah.
you'll know this was a 20-year-old male,
Okay,
healthy,
okay,
blah, 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 and you know that kind of thing. But
okay.
so the one thing, because a lot of patients ask me, oh, can I get the cadaver graft? And the beauty of the cadaver graft is that it's less pain for you.
Mm-hmm.
I don't have to harvest anything from you. You're going to have great function in all of the places where we would normally harvest from. However, especially in young males, young females also, but mostly young males, if you are a high performance athlete, the chance of re-rupture of a donor graft is high, right?
Okay.
So I would like, people ask me, but I don't offer to them myself. I don't offer to them as an option unless we have to do multi-ligament, right? Unless they've done PCL, ACL, a bunch of different things. And then it's like, okay, well, we're running out of sources on your body to take tendons from. So,
and that was kind of, you know, I got a lot of information about certain things, and even me playing all the sports I've played, wrestling as long as I have, I thought I didn't think my patellar tendon would be that great. So we had backup plans. If that wasn't intact or didn't look great, then he was going to go with the quad, you know. But the cadaver was like, that wasn't even an option, you know, really for me, because there is that chance of, you know, rejecting it, which is slim, but I don't want any of that. And I feel like even I had a little thing going on the incision that I think it was a bit of maybe a allergy or a reaction to some sort to even the sutures they placed under there. Like I felt like my body was trying to like push it out. So I had these huge, like they almost look like blood blisters. And it was like pushing them out. So just to be safe, the doctor got me on some antibiotics. And after I was on that for a week, it completely cleared things up. But yeah, I just went, and I did a lot of research. You know, I was looking at everything ACL and all athletes and stuff like that, that are at a high level. And a lot of them went with the patellar tendon. So I was just like, you know, there must be a reason why people are doing this. And I was talking to people in the Performance Institute that had suffered the same injury as me, and they were telling me what they did. So that was kind of, you know, made up in my head. I was doing that, and that was one of the better options that I was, you know, introduced to. So,
all right. So let's pick your brain now about the immediate post-operative period. I know I sent you a couple messages and stuff like that. So 2 questions. So number 1, how much pain did you experience with that? And then number 2, what are some recommendations now that you've lived it, right? You're not asking anybody no questions. You've lived it firsthand. You're like, holy crap, this hurts. So what are some recommendations that you have for people that might be watching that would go through this same thing for that initial post-op period?
Oh yeah, so this was something, like I was saying, this is definitely up there on the list for one of the most painful things, because it is such a, you know, a big area and joint. But for one thing, I do not like pain meds. I really don't. Like when I've had other surgeries, I don't take them.
You did this post-op period with no pain meds?
Yeah, so that's why this was horrible. So I would tell people, stay on the pain meds. Like for one, they did a nerve block on me. That thing did not work, because right out of surgery, the lady was like feeling my leg and toe. She's like, "You feel that?" I'm like, "Yeah." And she's like, "Oh," but maybe you can clarify this for me. But okay, so my mom is a redhead. I heard there's a gene for, you know, redheads when it comes to like anesthesia, when it comes to like Novocaine at the dentist. Like it takes so much for me when I'm doing like dental work. for it to numb me up. I've woke up on operating tables before with like the tube down my throat trying to pull it off because I burn through this stuff so fast. And I have a very high pain tolerance too. So yeah, so anyways, like after the surgery, I feel like the nerve block didn't work that well, or maybe I burned it off faster. I have no idea. But I was trying to go without pain meds also, because I hate the way they make me feel. And that was bad. So when I got out of, when I was in the recovery room, I was good to go. And this is one thing, I burn things off so fast, so I'm released a lot faster too than most people. It takes them an hour to wake up. They're back there all loopy. I'm like, I'm ready to go. So it was funny because even when my wife came back and I was talking to the nurse, and I was asking her questions, and then she was kind of ignoring me. She's like, oh no, he won't remember this. And she was telling, I was like, yeah, I will. And she's like, no, he will, because you know this is what he does. But yeah, so I went home. I was in pain. So before I left the hospital, they actually like loaded me up on something in my IV, and so I was sick. And then I wasn't taking any pain meds. So I remember the first night I was just like throwing up, you know, super uncomfortable, knees killing me. I slept through the night, woke up the next day, wasn't doing anything. I was in excruciating pain. And so this went on, I think I did the surgery maybe like 2.5 days. I wasn't taking anything, and I was in so much pain to where my wife finally got on the phone with the doctor, and he's like, well, has he been taking the stuff? And she said no. And he's like, he needs to do it. So they like doubled me up, and like I caught up. And so I did that for a few days and then kind of weaned myself off. And then I was done taking pain meds by, you know, it was a week out, maybe a day before or so. But that's one thing going through this. I would tell people, stay on top of your pain management, take the meds. Don't try to tough that out, because that's something I lost that fight. I can't even explain how painful that was. Like I was in so much pain, and then you have to have somebody that's there to help you, because I'm fortunate enough. My wife was working, and she had just like quit her job right before my fight. If she wasn't out there with me, I probably could have like managed somehow doing things, but I would have been in a lot of pain because I felt like worthless. I was telling people I felt like just useless. I couldn't even get out of bed. I couldn't shower. I couldn't change myself. Like just everything. She had to I felt like a damn baby. She was like helping me with everything, you know, for the first like week and a half, 2 weeks, and even further on, you know. It was hard for me even getting the passenger seat, you know. She's having to lift my leg up and do all this stuff. Yeah, it was painful. And I don't know if there was more pressure on the patella because I did the patellar tendon. So when I would lift it up, there was that much more pressure. Just everything about it was, man, just hell. And that's what I was like, I don't wish this upon anyone, even my worst enemy. And I was like, and I definitely don't want to go through this again, given how painful it was.
For sure. So two things that makes me think of. Number one, whenever I'm talking to patients preoperatively, I tell them, you will not like me for the first 5 days after surgery, because this is going to hurt like something out of this world. Like this is going to be one of the most painful things that you've ever experienced. So number one, I always tell them that, and it's not to scare people, but like you've lived it. It freaking hurts, right?
Yeah.
And then the other thing that I tell them is exactly what you just said. I said, look it, man. Trust me, I'm going to give you what you need to get through this time period. Do not let the horse out of the barn, because if you let the horse out of the barn, it's going to be really freaking hard to catch up to it, and you're going to be going like, I just got run over. How do I stop this, right?
Oh yeah.
So,
and that's one of the things, even going through, you know, obviously maybe a repair wouldn't be as painful, but the full reconstruction, like especially that like incision on the, like where the IT band is, or the quad, like where they drill through, that thing was sore for so long. And the doctor told my wife, he's like, at least he has strong bones, because it felt like cement when I was drilling through his, you know, his bones. I was like, oh God, like no wonder why this thing hurts so damn bad, you know. And I was joking around. I was like, I felt like they dropped that power tool or whatever they were drilling on me on my head, because like I woke up, I had like a lump on my head and it was sore, and I was like, I did not have, you know, this lump on my head before I went in there, but it was just it was a joke. It was pretty funny.
There you go. Okay, so listen, let's so you got the first couple days down, you got your pain under control, and how quickly after surgery was done did you start your rehab?
The next day.
Okay.
So that's also something. I was sitting there in that excruciating pain because I wasn't taking any pain pills, and this is the next day, and it's probably like 10 a.m. in the morning, and I didn't sleep good at all. I'll tell you that. But I was thinking, I was like, man, I don't know how I'm gonna get up and start doing PT on Monday. I don't get how I can do this. I can't even get out of bed, you know. And then I got a text from Heather, and she's like, hey, I want you to come into the PI in an hour for physical therapy. And I was like, what? I was like, okay. So it took me forever to get ready and then get there, and I was in so much pain. But yeah, they started it definitely less than 24 hours. It was like, yeah, it was probably like 15, 16 hours later. I'm doing my first set of PT on a Saturday. I got Sunday off, and then Monday was just 2 sessions a day. And for the next six weeks, I was there. And then after the first week, I was doing strength and conditioning as well. So I definitely recommend that too. People need to, prehab helped me so much just for the swelling to go down, strengthen the muscle. So I feel like I bounced back from surgery so much faster. Also, getting in to do physical therapy, even if I didn't do it the next day, if I started on Monday, I think people need to get in and do physical, and they're not aggressive like the first week, it's more like soft tissue, but just, doing certain things. I think that helped me so much because I talked to, even when I was talking to people at the hospital where the surgeon or did the surgery on me, like his assistants were, when I went to do the follow-up, maybe it was like, when you go 10 days after or a week after or something like that, for
Yeah.
whatever it was. Yeah, they were asking me like, oh, have you started PT yet? And I was like, yeah, the day after. But I think for like the general population or just things like that, I know insurance is difficult, and they only pay for a certain amount of sessions. So, I even talked to this one lady that she was like 3 months post-op, and she was telling me that she had the same surgery, and her PT sessions ran out, and it was only 12, and I was thinking I did 12 the first week, and I felt bad, and she still had her limp, and I'm like, I'm sitting in the waiting room like for my 10-day post-op appointment, and I'm seeing all these, like, they're older than me, and I felt obviously they're not athletes and stuff, but they're like limping in and doing this thing, and then I hear the doctor's name they're there for, and I'm just watching all these people. I'm like, oh, did I go to the right surgeon? But it comes down to the physical therapy. I think that's with a lot of things. Like, you need to do it. A lot of people neglect it, and it will it'll derail a lot of things if you don't stay on top of that. I feel like that's one of the most important things.
For sure. And, one of the things that I'll tell patients pre-operatively, I say, look at, man, you and I are going to be in a partnership, right? We are going to do a group project together. I am the lazy partner. I am going to do something that is only 5% of your outcome, right? Yeah. The other 95% is on you and what you do with your physiotherapist, man. And people think that we're joking when I tell them that, but no, man, like it's pretty easy to drill a couple tunnels and, pass a tendon and secure it on both sides. It's pretty easy to do that. But what's hard is to show up every day, and it's like, oh man, my knee is sore, my knee is tight, I don't feel like doing this, and then do it anyway, right?
Oh, 100%. And that's one of the things too. I think you have to go, like, if I could tell, and it's hard to tell people like, do this, because I'm in a different, I'm just fortunate that we have the PI, that we have all these professionals, and a lot of people don't have access to that. But I feel like you also, if you're an athlete, you have to go to someone that works with athletes and knows what you're trying to accomplish, knows what, because if I went to somewhere else and they just work with, a different demographic and stuff, and these are just people that work for the state or a desk job, and they're just trying to get back to their desk. Like, I'm trying to go and compete at the highest level in my sport. Like, I don't want to be the only person that this individual works with. you know, I want, like at the PI, that's all they work with is, you know, combat athletes. And it's like, so you really need to go somewhere, and you have to be selfish if that's what you're trying to accomplish. Like if I went somewhere and I could tell right off the bat, it just wasn't, you know, just wasn't cutting it, or like maybe they're knowledgeable, they know, but I kind of know, and I would just say, hey, I'm gonna have to go somewhere else because this isn't working for me. You have to be selfish if this is what you truly want to do. So athletes, you need to get into PT. You have to take your pain meds, and yeah, you just have to do your research. Go, you know, ask them what their resume is, things like that. Just like see the caliber athletes or whatnot that they've worked with, and yeah, you need to be a little selfish.
For sure, man, for sure. So tell me now, so we're now 7 weeks out. Um, Tell me about your average rehab session. How much time are you spending in rehab now? And what does your average rehab session look like?
Yeah, so now, you know, I'm still lucky because the UFC, I'm doing 5 days a week. I would still like to do 2 sessions a day, but yeah, I go and I kind of warm up on the bike just to kind of, because my knee is always, it's a little stiff in the morning. So just to kind of loosen things up, I hop on the bike for about 5 minutes or so, and then I'm doing a lot of manual therapy right now. So they kind of, you know, they get into the joint with their hands, you know, and they're just like working on just everything for about 30 minutes. In that time, they may take like the Graston tool, do some Graston, just a lot of like, you know, they're just working on the flexion, the extension, having me push and pull, do a lot of different things. And I'm on my back and then on my stomach. And then we get into like a small dynamic warm up. We do some band stuff. I'm just, every day is, I'm adding on just a little bit more. But we're really hammering just yeah, just strengthening my muscles, my quads, my hamstrings. I'm doing a lot of leg presses, hamstring curls, and then we alternate between other days where I'm actually loading up some barbells now, and I'm doing box squats with, you know, it's like barely any weight. It's like 65 pounds, but I'm doing it on like a 20-inch box. I was doing it on higher, but now we're kind of working our way, you know, a few inches. You know, I'm doing some RDLs, like Roman deadlifts. So I can do that, you know, and it's not even that heavy, but I'm still getting up to like 135 pounds, loading up the barbell and doing like a lot of tempo work. You know, like 4 seconds down, holding it for 2 seconds, and coming up, doing deadlifts, and those are, you know, on boxes and stuff. So I'm not doing a full deadlift with like a trap bar yet, but they're raising it up. So just to where I don't feel too much pressure in the knee, but that's still pretty lightweight as well. You know, it's I don't know, maybe 75 pounds, but I'm just doing a higher volume. You know, I've been doing BFR, things like that, a lot of the cupping. So my typical like PT session right now, sometimes I'm there for, I don't know, like 2 hours, you know, 2.5 hours. You know, they're taking some time with me, and then I come home, and that's when I do my my icing, because I have, you know, a game ready machine at home, so I'm able to just do that, so I don't have to, you know, take 30 minutes out of my physical therapy to ice my leg there. So I do as much work as possible with them, and then I come home and ice, and then I find myself all day just you know, massaging the patella, just massaging my quad, like doing a lot of quad contractions, things like that. Really just working on you know, just like the good mechanics when I'm walking, and like my, you know, gait and stuff like that. So I'm just constantly, I'm like obsessed with it right now, and that's, you know, that's what I'm focusing on right now.
Okay. Now, one thing that you had mentioned earlier is, you know, and we had talked a little bit about this, was timelines. And I have a couple people here asking about the timeline. So if everything worked out according to plan, what is your, when do you want to be back?
You know, like, yeah, if I could, man, I would want to come back early next year, you know. And I know a lot of people are like, will you fight this year? And people see me doing certain exercises. They're like, oh, you look great. Are you cleared now? I'm like, no, I just had full ACL reconstruction 7 weeks ago. But I don't think people understand, you know, the time frame. And I know a lot of people, I really don't know. Everyone's different, but I know the soonest someone will clear me would be 6 months before I can slowly go back to certain things, you know, so that's not fighting.
Mhm.
In a perfect world, they will want me to do 9 to 11 months of rehab and then get a fight. I know I can't rush biology, even though I'm trying to. Um, I know this. I do. I was hoping those stem cells kind of play a big factor, but yeah, I don't know. And I know different things talking to the physical therapist, and they're talking about, is it ligamentization or whatever, however you pronounce it. It's like
That's it.
18 months. 18 months is like when it's your part of your body and things like that. So I was even doing, you know, looking up that stuff and seeing the progression of the MRIs and things like that. So it's yeah, I don't know, but I don't know. We'll see. Hopefully April, May. I don't know. That's kind of, in my eyes, sooner would be better, but I really don't know. It's too soon to kind of tell. You know, it's only been, you know, a little over 7 weeks. I'm doing great, but I know I have a long road ahead of me. Um, but I will come back better than I have been. I promise you that.
Good. I'm looking forward to it. Now, listen, tell me, because I'm always telling patients about this time right here. You feel good, don't you? Like right now, you feel good, don't you?
Yeah, it's getting there. It's still, I think for me, it's still kind of stiff and sore just because I'm doing so much. So it's not like, it doesn't feel like my other knee at all, but it definitely feels like I couldn't even walk for, you know, I had to teach myself how to walk again. You know, that's hard. And so if the amount of pain I was in, you know, the first week or 2, 3 weeks after, if they said, hey, yeah, I've been back for, yeah, by 5 weeks, you're gonna be walking around, you're gonna be feeling great. Like, I would not have believed it. So I am getting better and better every day, every week. I'm getting stronger. So I do feel good. Like, I honestly feel like I could go run right now, but I'm not going to because they haven't cleared me to. Yeah, but I do feel good, way better than I have, you know.
Yeah, no, I know. I always have such a hard time because typically I see my patients 2 weeks, 6 weeks, 12 weeks, and then sort of every 3-ish months after that.
Uh,
And at this point right now, it's always hard because guys feel good. They're like, "Yo, can I run? Can I go do stuff?" And I have to say, "No, I know you
yeah,
feel good, but trust me, you are not ready." And this is why as your therapist told you, as the physician told you, the highest chance of re-rupture is now, right?
yeah.
Because you feel good, but the graft is not incorporated with the bone,
Mhm.
and it is not strong. It's at its weakest point right now.
Yeah, and that's one thing I think with Evelyn, they've kind of ingrained that into me. So I am like conscious of that. I'm nervous about that. So like even when I'm doing different things and like the next day it's like pretty sore, I'm like, oh man, did I screw this up? But I know it's strong enough where I just can't do anything stupid, you know. But I am super aware of that, and I will not do anything to re-injure this. And at the 12-week marker, I'm going to go back to Vegas. I'll go see the surgeon, do a follow up, and then I think I'm going to stay out in Vegas for a few weeks, and we're going to start doing, you know, a lot more things, like more lateral things, a lot more explosive things, possibly running at that time, not on the Alter G, or I'm not sure how it works, but you know, I ran or I jogged super light on the Alter G at like, I think I was at like 45%. So it felt like I was floating, you know, not really doing anything. It was at like the speed was at 4. I'm walking at 3.5. I feel like I could walk. I know I could walk that, but he wanted me just to do a little, like a minute or two of that. So, you know, I did that. So I'm looking forward to that 12 week marker though.
Cool, cool. All right, so tell me what, okay, so if you had to think about this now, what has been the single most difficult part of your experience since you injured yourself to now?
Um, yeah, it's probably just like the first bit when you're in a lot of pain and you can't do anything, you know. It's like you really, like, you need someone to help you. Like I literally couldn't get in. The bed was like pretty high raised, like get out of bed, like into bed for the first like few weeks. That was just tough. Like even changing, you know, like I was saying, changing, showering, like having to sit down while I'm like in the shower on one of those stools in a hotel. I'm like, man, it was so uncomfortable. But even the sense of like just being not hopeless, but just kind of like I couldn't do anything. Like I'm thinking about, say you're out and about and whatever it may be, if something happened, I can't do anything. You know what I mean? Does that make sense? Like say even if I'm sitting there and someone took my phone, I would have to sit there and just be pissed because I can't chase after them. I couldn't do anything. You know what I mean? Like it's like the sense of just like I literally could not. I would have to stand in place and do something, you know. But I can't do a lot. Like that's difficult for me, you know. And just being an athlete and always training. And I know I'm doing the physical therapy. I'm taking that serious. I'm working out in my garage, but it's still, it's just, man. I'm counting down the days till I can do a lot more because this is yeah, it's just boring.
All right. So we're running down to the end of the hour here because YouTube or Instagram cuts us off at an hour. So, but let me ask you a final question. So you've dealt with all the physical aspect of this, right? But obviously, you are a competitor and you want to get back in the ring. What have you done and how have you dealt with the mental aspect of your injury and this period of forced convalescence?
Yeah, and that's just something I've dealt with my entire MMA career. Just growing up, that's one of my strongest attributes is my mentality. Yeah, I'm doing things just so I'll get stronger. I could sit back and sulk and be like pissed about this, but I might as well work so I can come back, you know, even better. I've had so many injuries, like even just talking about the compound fracture. I've had broken ribs, separated cartilage, facial fractures, vertigo, broken hands. Like I'm sidelined. I've messed up my MCL, meniscus, so many elbow, shoulder surgeries. I could go on, but it's I always find a way in like when I set a goal, like I don't stop until I achieve it or I get what I want. And so it's like what I'm trying to accomplish, what I'm trying to achieve, it's inevitable. It'll, you know, happen sooner than later, but it's just taken me a lot longer to reach this goal. But it's, you know, it's all part of my story. It's all part of my journey. And it's going to be that much sweeter when I do get to the top because I have not had an easy road.
Perfect. Perfect. That's the perfect spot to end off on, man. So listen, please tell everybody, again, I'm sure everybody who's here knows who you are, but tell everybody where they can find you when you are not fighting in the ring or in the octagon, I should say, where they can find you and follow you.
Yeah, so like I said, you know, I'm a UFC fighter, ranked 7th in the world. I fight in the featherweight division. You can check out joshemmett.com, and that's JOSHEMMETT. You know, and everything's on there. My social media, Facebook, Twitter, Instagram, you know, it's Josh Emmett UFC. But a lot more in depth about me, a lot of the businesses I'm a part of, and everything I support and sponsors on there. So I'll go to joshemmett.com and yeah, I have apparel, anything, you know, there's everything you need to know about me is on there.
All right, perfect. So Josh, hang tight. I'm going to end this off and we'll finish up on Zoom. And to everybody else, thank you very much for coming and listening to our conversation. I greatly appreciate it. Without us, couldn't do this. So thank you very much. And we'll see you on the next time.
Cool. Thanks, guys.